possible. Now let's talk about latent tuberculosis infections versus active tuberculosis infections. And I would remember the differences between the two for testing purposes. Okay, not everyone who actually inhales that Mycobacterium tuberculosis is going to develop a full-blown case of active TB. Because what happens is that when many people breathe this in, our immune system recognizes it and it's strong enough to take care of it. So what it does is it says, hey, this should not be here. We are going to fix this. So the army of our immune system comes in and it surrounds that bacteria and it encapsulates it. Now, this person at this point has latent tuberculosis infection, but the body is keeping it dormant. Now, what can happen is that this bacteria can become active again. Why would it do that? Well, when the immune system becomes weak, or let's say the person gets HIV, so it can become active again and it can turn into active tuberculosis, which is what happens with a lot of these cases that we see. Many cases where a person inhaled this a while back, their immune system had it under control for a while, but then the immune system broke down and this germ got out and was able to infect and cause an active infection. So let's look at the differences between the two. How's your patient going to present? So first, with latent TB. Person has just inhaled it, their immune system is keeping it under control, and most people are not going to develop an active infection. They need that weakening of the immune system or something to make that germ come back alive. So are they going to be contagious? No, the immune system has it under control. Will they have signs and symptoms? No, they're not going to. They're going to have an abnormal chest x-ray? No, their chest x-ray is going to be normal because it's not causing any problems. How's their sputum? Is it going to have that Mycobacterium tuberculosis in it? No, it's going to be negative. So they're not really going to know. The only how they will know is whenever they go and get a skin test done, the PPD, tuberculin skin test, or the blood test, they will test positive for it. And that is because their immune system has seen this bacteria before. It's created this response to it. So when we inject that, the PPD in their forearm, or they get a blood test, we will see that their body reacts to it. Now, do patients who have latent tuberculosis still need treatment? Yes, they do, because it'll prevent them from having a possible active infection in the future. Now, according to cdc.gov, people who do not receive treatment, about 5 to 10% of them will actually develop an active TB infection. So they still need treatment, those medications. Now let's look at active tuberculosis. Are they contagious? Absolutely. They have this bacteria in here that our immune system just can't deal with, so it's flourishing and can infect others. Are they going to have signs and symptoms? Absolutely. They'll have those signs and symptoms that we just went over. Their chest x-ray is going to look abnormal. They're going to have a positive sputum culture because that bacteria is in there, which is why it's contagious, because they're putting it out when they cough, laugh, breathe, yell. And one thing that these two will share is that this person, of course, will also have a positive tuberculin skin test and a positive blood test. And with this active TB, because it is in the system, not being controlled by the immune system, it can easily spread via the lymphatic system and affect those other structures other than the lungs, like the brain, the joints, the liver, the kidneys,